Why do people still smoke in spite of knowing everything related to its hazards?
Smoking has become something like a part of a lifestyle. That's the right word to use it.
We frequently hear about e-cigarettes as a de-addiction or whatever name you give.
Cigarettes and vapes contain nearly about 70,000 chemicals.
What are the symptoms, signs and symptoms they should be watching for, which may be classified as early signs and symptoms?
Whatever smoke you're taking in, it blocks and clogs all the airways and the air spaces that is present within the lungs, which causes it difficult to breathe, which initiates symptoms like coughing, exertional fatigue, weakness, tiredness all the time. And moreover, they tend to clog the blood vessels or the blood channels that go to our brain or circulate within our body. But one thing we forget is that it contains high amount of nicotine. And because it contains high amount of nicotine, known to cause 16 cancers in the body.
What happens inside the body, especially in the lungs, which almost all of us are worried about?
The answer is it is less harmful, but it is still harmful. When you quit smoking,
Namaste everyone, welcome to yet another episode of podcast with me. I'm Dr. Amitabh Kulkarni. This is a platform where complex topics are simplified with the help of experts. Today's topic is something that will appeal to millions of people all over the world. Cigarettes, vaping or smoking. Are they same? Are they different? Are their side effects same? I'm very happy I'm joined by Dr. Rohit, who is a senior physician who has treated numerous cases of smoking related hazards. So he is going to tell us whether both are same, whether vaping is a suitable alternative to smoking, or we are just transferring one addiction to another. He is going to tell us what are its hazards on our health and how do we get rid of. Thank you, Dr. Rohit, for accepting our invitation for this podcast. Dr. Rohit, you have come here earlier also, but for our viewers' understanding, can you just tell us something about your background?
Thank you, Dr. Amitabh. It's indeed an honor to be here again and to share insights on such medically and socially relevant topic. So I'm Dr. Rohit Jacob. I'm a specialist internal medicine practicing in Dubai. I deal with patients who are troubled by communicable diseases or infectious diseases, non-communicable diseases, metabolic disorders like diabetes, hypertension, hyperlipidemia, also autoimmune conditions like rheumatoid arthritis, lupus, and so on. And I do also deal with people who are having lifestyle issues due to addiction, due to smoking and alcohol.
Thank you, Dr. Rohit. Indeed, we are lucky to have you here today. So, Dr. Rohit, we'll start with the basic question. Why do people still smoke in spite of knowing everything related to its hazards?
Very true, Dr. Amitabh. Smoking has become something like a part of our health today and a part of our lifestyle. That's the right word to use it. Because today, if you see, every 100 meters you walk, you will see one vape store. Every nook and corner you walk on the street, even when you're walking to the metro station, the only thing that is counted as dirt on the streets is the discarded cigarettes. So you can see how relevant it has become today. And the main reason I would say is that we all know the cigarette contains the main ingredient is nicotine. And nicotine, the way it works in our body is the reason why people are feeling that so addicted to it. So nicotine is a substance or is a chemical that is present in the cigarette which stimulates our reward center in the brain. And when it stimulates it, it causes release of excessive dopamine. And this excessive dopamine gives a sense of relief, a sense of calmness, a relief from stress. And that causes that addiction and dependence due to which they feel the urge to smoke again and again.
Yeah. So it's more of its a chemical quality that makes us addictive to nicotine. So then what happens when someone smokes? What happens inside the body, especially in the lungs, which almost all of us are worried about?
So it is not just the lungs that is affected due to smoking, and it's not only nicotine that is present in the cigarettes and the vape. So if you see, cigarettes and vapes contain nearly about 70,000 chemicals. That is the number that is present. Majority of it have not even been discovered. So it contains that much amount of chemicals and at least 16 to 18 known cancer causing agents.
So nicotine is just one of that,
Exactly.
Which has probably gained popularity, but there are a lot more chemicals than just the nicotine.
Very true, Dr. Amitabh. So the thing is, whenever a person smokes, it takes in all these chemicals inside, and it is not just the lungs that is affected. because whatever smoke you're taking in, it blocks and clogs all the airways and the air spaces that is present within the lungs, which causes it difficult to breathe, which initiates symptoms like coughing, exertional fatigue, weakness, tiredness all the time. And moreover, they tend to clog the blood vessels or the blood channels that go to our brain or circulate within our body. When this clogging happens, it not only leads to heart diseases, it can also lead to stroke and also different kinds of cancers.
Lungs are one of the organs, probably it affects heart as well as brain as well as even kidneys, it is known to. So then many a times these e-cigarettes or vapes are considered alternative to smoking. They are labeled as probably less harmful. So what is the fact behind that?
So very true, Dr. Amitabh. Actually, e-cigarettes and vapes, they came into the market to attract more number of people towards it, especially because of the new advancing flavors and all that's coming in.
True.
But the term that e-cigarettes and vapes are generally more safe is a wrong word. It's actually a misnomer. The answer is it is less harmful, but it is still harmful. And it does not come in the safe category. So because e-cigarettes and vapes definitely contain less number of chemicals and cancer-causing agents compared to the traditional cigarettes, but still the amount of cancer-causing agents and harmful chemicals are still on the higher side. And the e-cigarettes and vapes can be used, or you can say, as a replacement, but there are people who are using both, and that finally leads to dual addiction rather than, getting withdrawn from it.
Interesting. So viewers, please understand it's not a safer alternative. But in that case, is it less harmful as compared to just the cigarette?
Okay, Dr. Amitabh, actually the thing is, it has not been scientifically proven for a long-term study. Short-term studies have shown that the chemicals that are present, although they are less in number, but the harm done to your body still remains the same. I'll give you an example. If you look at vapes, vapes are known to cause a condition which is called as popcorn lung. So popcorn lung is when the vapes, the chemicals that are present in the vapes, they tend to block the air spaces present in the lungs, which leads to a chronic cough which the patient is always troubled with, like an irritant, dry cough that keeps on coming even when they even talk. So that level of damage occurs even with the e-cigarettes and the vapes. But of course, compared to the traditional cigarettes, yes, it is little bit less harmful.
In that case, what are the like we know in cigarette it's nicotine. So what are the chemicals present in vapes then?
Right. So sir, if you look at cigarettes, I'll compare between cigarettes and the e-cigarettes and vapes. If you look at cigarettes, it not only contains nicotine, it also contains heavy metals like lead, nickel, chromium. It contains formaldehyde, it contains acetaldehyde, benzene, toluene, and various other cancer-causing agents. But if you look at vapes, they contain nicotine, definitely. Along with that, it also contains heavy metal like lead, nickel, and chromium. It also contains something called as propylene glycol or vegetable glycerin, which is the one which imparts the flavor to it. Along with that, you may also see formaldehyde, acetaldehyde. Then there is a specific class of compounds called VOCs, volatile organic compounds. So this is another set of cancer-causing agents, and it also causes headache, dizziness with it. You might be surprised by the amount of knowledge I have related to this, but the fact is that I don't smoke. I visited a vape store to get more knowledge related to it.
I was just wondering whether the manufacturer will dare to mention all these content on the packets or which they sell. So so many chemicals, even I was not aware about it. Thank you for adding to my information. Now frequently we always relate smoking or vaping with lung disease. Is it the fact, is it only lung disease, or even heart disease or other organs also are equally involved?
Right. So just like I said, Dr. Amitabh, I'll give you an example. I had one patient, a 50-year-old male, who came with a complaint of heaviness over the head since last 8 to 10 months. And every time he, along with the heaviness over the head, he used to get a dizziness, some kind of chest discomfort. And that was the case. And he visited multiple doctors, he visited multiple clinics. He got an MRI scan done. He even got MRI angiography done and checked whether there is any blockage anywhere. And then finally he was treated for migraine for a long period of time. And nothing worked out. And then that's when he visited me once. So when we did a blood workup, we found out his hemoglobin was 19. The normal hemoglobin comes to between around 12 to 15 kind of a range, but his hemoglobin was 19. And there's something called as a packed cell volume, which is present as a label in the CBC. That was around 55.
Wow.
So you can see that indicates that his blood viscosity or the blood thickness that is present in his body is very high. So that's when I asked him, he said, yes, he does smoke. He's a chain smoker. Smokes at least 40 to 50 cigarettes in a day. And I told him very clearly that, the smoking is the cause for you and you have no option but to quit it. But of course, gradually quit it, because then he would develop withdrawal symptoms. And eventually, as he reduced smoking, that's when his symptoms started improving. So that is the impact that we get, and that is the impact that we still don't know smoking has on our health. There are some people who develop very high heart rate, because when they smoke, the heart gets stimulated and the heart rate increases. They get cardiac failure, they get ischemic heart disease, which we commonly know about. They get stroke, they get different kind of cancers, they get blood vessels damage even in their legs and their hands. Correct. So there is not a single organ in the body which is not affected by smoking.
So viewers, please understand, typically we presume, especially if you are a smoker, you will think that only it will start with coughing, if at all any hazardous effects of smoking are there. But as Dr. Rohit clearly mentioned, not just lungs, it can affect almost all the blood vessels in the body, whether it is in the heart, whether it is in the brain, whether it is in the legs. So you may have symptoms related to any of these organs, especially if you are a chronic smoker. Now, frequently, Dr. Rohit, maybe patient is smoker, but if his friend who is a passive smoker or second-hand smoker, is he equally at risk of smoking hazards?
That is a very valid and very relevant question today, sir. The main reason why smoking has become so evident even among non-smokers is because their family members, their friend circle, they are the ones who smoke. Now, there are people who come to my clinic and they always tell me that, I don't smoke at home. I don't smoke at home at all, so I'm sure my family is not at risk. But they don't understand one thing, that even if you're a chronic smoker, if you're sitting at home and even if you're not smoking, exhaled air also contains the smoke particles that you have been smoking for a long period of time. And that exhaled air tends to damage the people whom you're living with, and they start getting various symptoms like, seasonal asthma, breathing issues, fatigue, tiredness, and things like that. There was one family I remember who came to my OPD, and it was a father, a mother, and a child. And the child had a big glass. He was wearing a spectacle. I think his number would have been around 5. And his teeth were widely spaced. So definitely he had a little bit of intellectual disability. So I asked the mother casually, what happened? And they said, since he is born, he is autistic. So that's what the mother told me. And then afterwards, and she was pregnant now for the second time. And the father came to me for chest discomfort and a dizziness. So I asked him that, about his history and everything. And then I asked him whether he smokes. He said, yeah, I've been a smoker since a long time. So they have not realized one thing, that he has been smoking since a long time. That smoking has not only caused his wife to be affected by it, but is also his child, because smoking has a very important relation with autism. So this is the level in which smoking has affected even the people who are the victims of secondhand smoke. So that is something that we all should know.
So not just smoker is damaging his own health, his family members are also affected. Very scary.
That's true, sir.
So, what is frequently it is blamed to cancer also? What is the link between smoking, vaping, and cancer?
Just like I said, sir, smoking has got innumerable cancer-causing agents, be it from heavy metals to formaldehyde to VOCs and different compounds present in it. You name the organ, it causes cancer related to it. Especially smoking has been known to cause 16 cancers in the body. Wow. You start from the mouth, it causes mouth cancer, it causes voice box cancer, it causes throat cancer, foot pipe cancer, stomach cancer, liver cancer, pancreatic cancer, even up to the reproductive organs where it can cause ovarian cancer. This is the level in which smoking has affected cancer or causing cancer as well. The main reason why it is so much associated with cancer is because smoke contains these chemicals which damage the DNA at a cellular level, due to which the cells are not able to regenerate on its own. Yes. It causes uncontrollable growth of these cells, leading to tumor formation inside the body. So that is the mechanism by which this is happening. And we must be aware how long-term risk of smoking can lead to such cancers.
So it's not just the lung cancer, but so many cancers are
Very true.
associated. Now you already mentioned there are flavored vapes. Now is it more for addiction? What exactly are flavored vapes, and why teenagers especially are getting addicted to that?
Right, a very, very important question, sir, because today, if you see in the market, the young adolescent age group or the teenagers are the ones who are most addicted to smoking, and the main reason I would blame for it is these flavored vapes. Because the flavor, if you look at any vape parlor, the amount of flavors you see would be like strawberry, will be raspberry, will be pan rasna, will be mint,
Wow.
mint, lemon. You can name the fruits, all those flavors are there. And these flavors are the ones which are attracting these young adolescents. Let me tell you, sir, it's not only about the flavors. Even technology has not only improved in our professional life, but also in these addictions. The current vapes, they also have a smoke counter, which states that, it gives an alarm signal if you're taking more. It gives an alarm signal if you're taking in the right proportion, if you're taking in the right way, and things like that. But nobody realizes that fact that even a small amount or even mild smoking can cause so much of deleterious effects. So just like I said, these flavors are the ones which are inviting young adolescents towards trying it more. Another reason for that is peer pressure. In a group of 10 children or 10 adolescents, if 9 people are smoking, one person, if he doesn't smoke, he is considered like not being included in the group or not including in the group.
FOMO, yeah.
Yeah, like something like fear of missing out. That's absolutely right. And due to which he is bound to smoke, and once he smokes, the frequency keeps on increasing, and then he becomes a victim to these vapes and cigarettes.
No wonder teenagers are getting addicted to that. What exactly is in nicotine then? Why is it so addictive?
Very true, sir. Nicotine, just like I said, is a chemical which hampers the nerve signals in our brain, and it stimulates the reward center in our brain, and that causes the release of dopamine. This dopamine is a stimulant which is a hormone which is secreted by our body itself, but with nicotine, it is secreted in high amounts that leads to stress relief, calmness, feeling of being free from all kinds of tension, and an elevated mood kind of a thing. Whenever a person smokes, when he gets this kind of a feeling, he craves for this feeling again and again. And that leads to addiction. And the second most important thing is, when he tries to withdraw from it, it causes extremely high withdrawal symptoms like headache, dizziness, restlessness, irritability, weakness, and violent behavior also. Because of these withdrawal symptoms, he would always go for it again rather than getting withdrawn from it.
Maybe
and
that is
why
the
it's so
reason
addictive.
why they get addicted.
Very true.
Not just the positive effect, but also the withdrawal symptoms.
Very
that,
true, very
that
true.
makes them.
So basically, it is, in medical terms, it's called the fear of loss of reward. So the fear of loss of reward makes them more impacted towards getting addicted.
Correct. Dr. Rohit, we frequently hear about e-cigarettes as a de-addiction or whatever name you give for nicotine addicted people. So what exactly is the science behind it, and are they really de-addicting, or we are just making them dual addiction? Like from one addiction it is dual addiction. What exactly is that?
Very true, sir. E-cigarettes and vapes have come into the market because they have shown, or they are marketed, that's the right word, they are marketed as less harmful. They do contain less number of chemicals, they do contain less number of cancer causing agents, but one thing we forget is that it contains high amount of nicotine. And because it contains high amount of nicotine, it is more addictive than the traditional cigarettes. Okay, and along with that, what happens is, when you take e-cigarettes and vapes, this nicotine dependence tends you to opt for it more and more. For a person who is taking traditional cigarette and for a person who is taking e-cigarette, you can switch it to aim for de-addiction. But of course, it's important to continuously reduce the amount that you're taking and get withdrawn from it. But more important thing is, you should not take both together, because that has led to dual addiction. There was one study which actually compared between the people who are getting de-addicted from a traditional cigarette and from e-cigarettes and vapes. And out of 100 people who are wanting to quit smoking, 8 to 10 people have quit smoking from e-cigarettes and 6 people have quit smoking from traditional cigarettes. So basically, it's only a mild difference. It's not much. But of course, you can try to replace your traditional cigarettes with e-cigarettes and vapes, but it's important that you regulate and you withdraw from it eventually.
So then in that case, e-cigarettes are more marketed said if you want to quit smoking, so that is not the fact actually with the help of statistics and all. They are also equally addictive, and they also contain nicotine, which is there. I think it is in the vape, it is there in the cigarette, it is there in the e-cigarette as well, which is more causing addiction.
Very true. So actually, if you compare why e-cigarettes and vapes came into the market, it is not for social health concern. It's not to make people withdraw from smoking, but to attract more customers to it, because it's a pure marketing strategy. And it's important that we do not fall to these marketing gimmicks and take a wise decision.
So someone who is like smoking in whichever form, whether it is vapes, e-cigarette, or traditional cigarettes, what are the symptoms, signs and symptoms they should be watching for, which may be classified as early signs and symptoms that this smoking or addiction of nicotine is damaging their health?
Right, sir. So the first symptom when someone smokes is your heart rate. Your heart rate tends to rise. You will feel that your heart is beating too fast. You tend to get a sign of palpitation. That is the first symptom which we usually get. And along with that, you may get symptoms like tiredness, restlessness, irritability. You may also get symptoms like dry cough, irritant cough, a fatigue. When you climb stairs, if you were having good stamina and you were climbing 100 stairs earlier without feeling short of breath, you may start feeling short of breath with just a flight of 10 stairs. Then you may also feel some kind of abdominal or tummy discomfort. Some people get bloating due to these e-cigarettes and vapes, and also symptoms like nausea, vomiting sensation, cough and chest discomfort, palpitation, headache, heaviness over the head. So you name the symptom, everything is there in it. So that's the way in which cigarettes, be it traditional e or vape, how it has impacted in our body.
So someone who is smoking and otherwise was in a good health, any new symptom he should be careful that this might be related to smoking, and he should get it checked. So if someone decide to quit smoking for good reasons, how early he should expect the improvement in these symptoms then?
That's a very important question, I would say, because when a person quits smoking, people think that it takes a lot of time for the symptoms to improve, but that's not true. When you quit smoking, the symptom improvement starts within minutes. The first symptom improvement you would see is your heart rate starts flattening and it becomes better. You will start feeling a feeling of relief rather than that anxiety and palpitation that you were feeling. Then eventually you will also feel that your cough is reducing. You will feel your tummy discomfort, bloating is reducing. Your restlessness and irritability is reducing. And over a long period of time, the risk for heart disease drops by nearly 40 to 50%. Then the risk of lung issues also drops by nearly 30 to 40%. And the risk of stroke, blood vessels damage, all these things eventually start coming down. So every symptom that you faced while you were smoking, all those symptoms starts resolving one by one. But of course, the withdrawal symptoms that you have due to the nicotine, it takes few weeks to months for it to completely subside.
But in today's fast-paced world where everyone want an instant result, definitely if you quit smoking, as Dr. Rohit said, within few minutes, few hours, you will see the benefits. Definitely these will continue to improve over period and give you just the positive health effects. Now, Dr. Rohit, you and me are doctors who are dealing with the consequences of smoking, hazards of smoking. So what is our role? This is more of a social problem than as a doctor. What is our role, you think, in controlling this addiction or spreading the knowledge about the hazardous effects of smoking?
Right. So I'll give you an example. I just remembered a case like this. So there was one middle-aged man who came to me totally depressed, and he had a little bit of chest discomfort, dizziness, irritability, and he took multiple vitamin supplements, multiple treatments, and he could not get better. So then what we did is I took his entire history, and the psychiatrist and me, we sat and we discussed with him. When we spoke to him, we got to know that he had a change of job since last 1 year. From a fixed salary, he moved to a sales commission job. And because of that sales commission, his income dropped. Because his income dropped, he started developing family issues. personal conflicts with his wife, and along with that, he used to hit his son. His sleep got disturbed. He became more irritable, started getting more headaches, and entirely his life was completely troubled. So people were actually, treating with vitamin supplements and treating the symptoms, but the root cause was these. And along with that, he developed a very severe pattern of smoking addiction where he smoked 20 to 30 cigarettes per day. So analyzing all these things together, we suggested him that you move to a fixed income job. And eventually, over 3-4 months, when he moved to a fixed income job, after that, one by one, his problems started getting solved. And today, he's on the verge of getting de-addicted from smoking. So it is not just about analyzing what is the symptom, but also understanding what problem each person faces and what is the reason for that smoking. So root cause of that smoking, be it social, be it medical, be it personal, be it economical, whatever it may be. If we analyze the root cause of it, analyzing and treating and managing the root cause can help get de-addicted from smoking better.
So this is a very, very interesting case which you have shared. So then if there is, if you want to bust one single myth related to smoking, cigarettes, e-cigarette, vaping, whatever, what is one single myth you want to bust today?
I'll tell you the common, the people who vape, they come to my clinic and I ask them, do you take cigarette? No, I just take e-cigarette and vape. I just take vape. That's the thing. Correct. So, but vape is not harmful. It is just water vapor. This is the answer I always get with respect to smoking. So, vape is not water vapor. It is a chemical fog machine. That's the right word to use it.
Correct.
Okay, because I'll just tell you how the vape works. It contains a liquid and it heats the liquid, generates fumes or aerosols, and that aerosols is inhaled, and that is the one which causes all these problems. So it's a chemical fog machine which contains multiple chemicals that is damaging each and every part of your body 1 inch bit by bit. Yeah. So anytime if somebody tells me now that it's just water vapor, I tell them to add little bit of formaldehyde in their morning coffee.
Thank you, Dr. Rohit, for answering all the questions with a clear and distinct solution. Now, that brings us to the next session which we have added in our podcast, and these are one-liner fun questions or rapid-fire questions. So, are you ready for that?
Okay, I'll try my best, sir.
Cigarettes or vape, which smells worse?
I think it is the mouth after smoking either.
Yeah, so very, very nice. First thing you would ban, cigarette ads or vape flavors?
I think I would go with vape flavors because we might have heard of the famous Gutka Mukesh ad.
Correct.
So because of that, I don't think Gutka has come down in the market. Right, so vape flavors are the ones which are attracting more adolescents. You just stop the vape flavors, probably the number will come down.
Yeah, very smart answer. One word to describe nicotine?
I think helps you lose your breath and money one puff at a time.
Which is stronger addiction, caffeine or nicotine?
Just imagine caffeine and nicotine walking to a bar. Nicotine is the one which helps you buy the rounds every day, and caffeine is the one which keeps you awake after party. So probably both.
So do doctors secretly judge smokers, yes or no?
Doctors don't judge smokers, but doctors do judge smokers who justify smoking.
If a cigarette pack could talk, what would it say?
Cigarette pack would say, contents will help you run faster, not for fitness, but for the doctor.
Cold turkey or gradual quit, which works better?
Definitely gradual quit, because one day quit can cause immense withdrawal symptoms, and gradual quit is always best.
If smoking had zero health risk, would people still do it?
Definitely. In fact, I feel more people would do it because people sitting on their desk job would always look for a reason to get up every 30 minutes.
One emoji that best represents vaping?
I think it's not a face, it's that circular thing. There's one circular emoji which just bounds around like this. That's the feeling after taking vape and cigarettes.
And favorite myth you have heard from a smoker trying to justify their smoking?
Just like I said, I think it's that vape is water vapor. Yeah. So that is a big myth that I've heard. Clearing that out takes a lot of pain.
Yeah. Thank you, Dr. Rohit, for quickly answering this rapid fire question. That brings the end of this very fascinating, interesting, helpful podcast. Thank you, Dr. Rohit, again for clearing all the myths. Viewers, please understand smoking has various forms, whether it is a cigarette smoking, e-smoking or vapes. All these three we have discussed today. Its hazards, its effect on not just lungs, but it can affect any organ of the body, be it heart, be it peripheral vessels, be it brain. Dr. Rohit also told us how we can see instant benefits after smoking, which will start probably in few minutes. Like the heart rate will settle down, you will also feel calm, and over a period it is just going to benefit. So someone who is getting carried away with various marketing gimmicks related to whether it is a flavored vapes or e-cigarettes for de-addiction, be careful, do understand every point what we have discussed in today's podcast. The purpose of this podcast is to get clear facts from the experts. If you have any question related to today's discussion, you can put it in comments. We will be very happy to answer those questions. If you want Dr. Rohit to discuss any other interesting topic in future, please do mention it in the comments. Do subscribe to the channel. Please forward this episode or discussion with someone who is either addicted to smoking, addicted to flavored vapes, or who is justifying their smoking for whatever reason, or who is already suffering. If any of near or dear ones is suffering from the health hazards related to smoking. This is me, Dr. Amitabh and Dr. Rohit signing off from today's discussion. Take care of your health. Prevention is better than cure, as we doctor always say. Thank you very much.
Thank you. Thank you, Dr. Amitabh.